Are you considering a career in medical billing and coding and not quite sure what those jobs really entail? Well, today I'm going to talk to you about medical billing and coding and what a day in the life of a medical biller or coder looks like. Hey, I'm Victoria Moll. I'm a medical coder, auditor, educator, content creator, national speaker, and I'm most popularly known for my YouTube channel, Contempo Coding. You can find me on Instagram and TikTok at Contempo Coding. Today I want to talk a little bit about medical billing and medical coding. So medical coding is the process of reading medical records, reviewing them, analyzing them, and abstracting all of the different diagnoses, different services, and different procedures, and then translating them into different code sets. Medical billers then take those codes and make sure that they are submitted to the insurance company to get the complete reimbursement for all the services that were rendered. So a medical biller is responsible for reconciling all of the billable services, getting them onto a claim form, and making sure that they are submitted timely to the insurance. They are really insurance experts. They know all the different guidelines. They know how to get them submitted cleanly and paid at the appropriate amount. They know what amounts they should be paid at. And they also know not just the insurance guidelines, but just general billing guidelines and federal guidelines. How to handle if a patient has two insurances, to know which one pays first and which one pays second. And also things like how long they have to submit an appeal when a claim is denied. Medical billers work with revenue cycle staff, department managers, office managers, practice managers. They work with the physicians, they work with the coders, and sometimes actually the biller and coder can be the same person. So medical billers make sure that everything that was done, all of the great services that were provided by hospitals or providers that we can bill out to insurance get paid, and they get paid at the maximum amount. And they work all of those denials to make sure what they can do to get those paid. A lot of medical billers can work from home. They work for insurance companies, billing companies, they work for healthcare organizations. A lot of them do also work on site, oftentimes in very large billing offices, or they're embedded somewhere within that hospital or healthcare organization. Medical billers are also really great at patient advocacy. They want to make sure that the patients are not paying out of pocket for services that the insurance companies should really be paying for. So they are willing to work very hard with these insurance companies, proving things like medical necessity, pulling out records, working with the providers so that they can reduce some of that patient burden and make sure that the insurance companies are the ones paying for the services when they're medically appropriate. Medical coders are responsible for reviewing records. It involves a lot of reading, a lot of interpreting records, pulling out what services were provided, what procedures were done, and what diagnoses the patient has, and then translating them into code sets. For example, this book right here is ICD-10-CM, and it's for diagnosis coding. Now, there are different services for the electronic medical records and what we call encoders that can help guide you a little bit through the medical coding process, but there's so much involved in regulations, compliance, very unusual guidelines for medical coding. So it's not just a one-to-one match like looking up something in a phone book. It really is analyzing, reviewing, and deep diving into the medical records to get things coded to the highest specificity and highest accuracy. Medical coders work with a lot of the same people that billers do. They might also work closely with people who are doing pre-authorizations for surgery so that they make sure that they're calling the insurance company with the right CPT code to make sure that that gets reimbursed through the insurance company, that it's something that they are approved to have paid for. Coders probably work a little bit closer with physicians and billable providers because if they see something in the documentation that maybe wasn't specific enough or was omitted or was unclear, or they need to have tweaked so that they can get a better code submitted to show the appropriate picture of what happened to this patient and make sure that we're coding for the highest specificity and the fullest completion of what was performed, they'll have to work with those providers and follow up on those queries or request to addend the documentation with the providers. Coders also work for insurance companies, billing offices, health insurances. They could work for small private practices or large healthcare organizations. There are large companies that just do revenue cycle, so they just hire billers and coders, or they could even become instructors and train in medical coding. Also, as you advance in medical coding, this is one of the great careers that has a lot of advancements. So you can go into things like compliance, you can go into auditing. I have friends that make really good careers out of working in the legal sector of medical coding. But what about the day in the life of the medical coder? What does it kind of look like? How do you get your work? So there's a couple of different ways. Oftentimes coders will have what they call a work queue. It's just a listing in the practice management software or electronic medical record that has all of the names of the patients, the MRNs, the dates of service they were seen, and the medical coder clicks on them, pulls them up, looks through the chart, abstracts all the information, submits all the claims, sends it out, and then goes to the next item in their work queue. Or they might have reports that they pull. They might pull a certain provider name and date range and say, I want to look for all of Dr. Smith's services from last week, pull everything that Dr. Smith did last week, code out all his services. Or they might have a listing that's sent to them by a practice manager. Maybe the practice manager pulls a report, or someone in the hospital pulls the report and forwards it over via email to the coder of all the things that they're supposed to code and send out. But oftentimes it doesn't end there. It isn't just, oh, I coded it, it's out the door, and now we're done. They have to work with the billing staff and the revenue cycle staff sometimes if something hits maybe an edit that they say, hey, Highmark doesn't usually pay for this service with this diagnosis. Can you take another look at the chart and see if maybe somewhere in there is this more specific diagnosis so that we can get it paid through the insurance? And they'll have to communicate with the staff and go, oh, you know what, I looked at this and you're right, there is something else in there. Or they might say, hey, you know what, I can see somewhere else, maybe this patient had a past history of this diagnosis. Let me talk to the provider and see if I can get them to correct the documentation. Or they might say, hey, this patient doesn't have this diagnosis, like they just don't. And I know that this is the diagnosis that will get paid, but it's not compliant to put it on here because this patient doesn't really have that diagnosis. There are coders also that just work denials, that there might be certain things that get denied because of incorrect coding, and they just look at those incorrect coding denials and reanalyze those, see if there's something else that they maybe weren't coded correctly the first round and need to be corrected. And some coders just do kind of quality checks, that maybe the provider bills their own office visits, and the coder goes through and checks on them and makes sure that they're submitted accurately before they go out the door. Or they might just review some of the high risk things that they know are likely to get denied, or maybe the providers don't select the right codes, so they review specifically those high risk items before they go out the door. Medical billers have a lot of work with the insurance companies. Oftentimes they'll get reports of denials, and they'll work with maybe sets of insurance companies, call up Medicare, work through portals, try to find these reasons of why these claims were denied, or maybe why they weren't paid at the full amount, and work with those insurance companies so that they can understand what they could do to get it paid, if there's maybe a modifier missing, or if maybe something wasn't pre-authorized correctly, it wasn't done on the right date of service, if there was anything that they can do in order to get that claim paid. They work with things like timely filing. Different insurances have regulations of how long you have to submit an insurance claim. So some may say that has to get out the door 30 days after the service has been rendered, 60 days after. Some are more lenient. They might say 365 days. So they'll monitor and see, okay, is it getting close to that timely filing limit that we have to get this out the door? Billers also work a lot with appeals. So if something was denied, they might have to pull different records and send them out to the insurance company. They might have to get the provider to write a letter of medical necessity and send that out to the insurance. They might have to pull and see, was this pre-authorized correctly? Maybe they didn't even select the right code, or maybe when the patient was in surgery, the plan changed and something else had to happen instead of what was initially pre-authorized, and they have to go back and correct that as well. So you can kind of tell from what I discussed that neither of these are actually patient-facing positions. They're very much behind the scenes working with the back office staff. Some things you really need to know before deciding to get into a billing or coding career is that this is a very desk-heavy job. It is a job where you are probably spending 95% of your day sitting at a desk working in different systems on the computer. Medical billers can be really great patient advocates and help with some of those financial strains that patients can have because of medical bills. Medical bills are actually one of the #1 sources of bankruptcy in the United States because of how expensive they are. And medical billers are really challenged with that task of analyzing these medical bills and determining, is this something that the insurance company really should have paid for, and how do I get them to make that payment for this medically necessary service? Medical coding has a great variety of things that you can do. I mean, if you think about every single medical specialty that's out there, coders can specialize in just about every different specialty: gastroenterology, pediatrics, internal medicine, surgery, bariatrics, plastic surgery. I mean, any specialty you can think of, you can specialize in as a medical coder. And there are specialties that do pay more, like interventional radiology, because it is more complex. Now, if you're a medical coder working from home, you can sometimes deal with things like isolation, but there are lots of great associations you can join that you can participate and coordinate with other medical coders, go to virtual meetings. There's also big conventions that happen in medical coding that you can attend as well. And like I said, there's lots of career advancement. You can get into teaching, you can get into consulting, you can get into auditing, you can get into legal stuff with the medical coding and advocate for patients on that end by making sure that the court cases have the accurate coding and that everything was coded accurately if that patient was denied payment. A lot of medical coders are introverts. There's always going to be a place for people who just want to be behind the scenes, look through the medical records, submit the codes, and kind of work with that. But the coders that are more willing to partner with providers to have those difficult conversations, do things like audits, talk about their process improvement, their documentation improvement, those coders tend to have much more lucrative careers because there's so many that want to be behind the scenes. They're the ones that are willing to go out there and work side by side with providers on a higher level and partner with them and know, hey, I have your best interest at heart. I want to make sure that you get all of the money that you're entitled to for the services that you provided, but I want to make sure that you do it compliantly as well. Those coders tend to have much more lucrative careers. Let's talk pros and cons. Pros of medical billing is it's oftentimes easier to get into than medical coding. In fact, a lot of medical coders have to start out in medical billing before they get into coding. The con about medical billing is that it usually doesn't pay as much, at least to start. There are positions you can grow into, like supervisor positions, revenue integrity, but an initial medical biller position typically doesn't pay a whole lot of money. The con about medical coding is that it can be hard to get into. It's not like nursing where you've done certain clinical skills and demonstrated them. Medical coding, you can basically almost self-study, and then as long as you have a certification, that's what employers are really looking for, is that medical coding certification through AAPC or a HEMA. So because of that, employers tend to be a little bit more reluctant to hire new coders because they're not sure if they really just knew how to pass the exam or have the skills needed to code in person. So if you're looking for something that you can probably get into easier and work on the back end, medical billing might be better. But if you love doing that analytics, that record review, and working with providers, and you're willing to maybe be in it for the long run, knowing that it will have a financial gain as you progress through your career, medical coding would be fantastic for that. There's a lot of quality programs that go on now where providers receive really good incentives for treating patients that have severe, costly diagnoses that are identified through the medical records and through the coding, things like HIV, heart disease, cancer. And if they take really good care of those patients, keep their costs down, they receive those incentives. And we identify those as coders through the diagnosis coding. So there's a lot of new opportunities to review specifically diagnosis coding with these records to facilitate these bonus payments for providers. If you're interested in getting into medical billing or coding, they're not super long programs. A lot of places can do them in 6 months or 9 months. Check with some of your local community colleges. Check with some of the programs that maybe you have through your healthcare organization to see what they reimburse. And as long as you get a certification as a coder through a HEMA or AAPC, that's really the key. There are also some great billing certifications you can get through the AAPC or the NHA, and those will help you find a billing job. But actually, there's no certification requirements typically for billing positions. I hope that helped clarify some of the differences between medical billing and medical coding and facilitated you making a decision about whether or not this is a career that you might want to get into. If you have any questions, feel free to hit me up on social, and definitely check out my YouTube channel because I host weekly AMAs where you can ask me anything about the medical coding industry. Thanks for watching, and I'll see you next time.